This video is on the reproductive models. We start with the torso models, and I just want you to appreciate first that these reproductive organs in the male and the female are tucked into the pelvic cavity region. There you can see, well protected by the hip bones and the pelvic bones. So we're going to take them out and take them apart. So we'll take the male one out and the female one out, and we'll move over here. And here you can see that they would be tucked right down in here. The true pelvis down beneath the pelvic rim here. And there's your pubic bone, which would be protecting the bladder. Everything else will come down here. All right, let's start with the male. Put these back together here. So from the outside, just from the side view, of course, we can see the penis and the testes here. Now, particularly on the penis, we can see the glans of the head and the shaft. And on the testes, we can see the testes ball that makes the sperm. And we can see the epididymis that stores the sperm. And then we start to see the spermatic cord here. Now remember, that has the vas deferens in it, which will carry the sperm up and out. But also in the spermatic cord, as you can see, are blood vessels, nerves, and connective tissue. So that's going to go up into the body. So now we'll take this off. Now we can see a lot more. Let's get this on here a little better. Okay. So here, let's just follow a little bit of what happens here. From the testes where the sperm is made, you can't really see the epididymis on this piece, but you can see the spermatic cord coming up here. Now we can see the vas deferens come out and go over the bladder. This would be the bladder. Now remember, as the sperm goes in the vas deferens, this seminal vesicle gland adds sugar, glucose. And then this prostate gland here, right beneath the bladder, is going to add the milky substance to further nourish the sperm and give it a little cushion. Now, as the sperm comes here down this little ejaculatory duct, we call it the ejaculatory duct between the seminal vesicle and the prostate, which is right under the bladder. We call that the ejaculatory duct. And then the sperm will join the urethra from the bladder. Now this little gland is the third gland that adds substances to the sperm. And that's the bulbourethral gland, because it looks like a bulb and it feeds into the urethra. Remember, that's the one that secretes the silky alkaline substance to clean out any residual urine in the urethra. Now we're starting to get into some of the penile tissue here. So I'll go over that. First of all, again, we have the head or glans, we have the shaft, and then there's a large root that holds the penis in place. Don't forget about that. So we've got root, shaft, glans, or head. Now, if the male is not circumcised and has a foreskin, it would be called the prepuce. The other thing we can see about the penis is the two types of tissue. The one with caverns in it that fills up with blood and gives the male erection would be this dorsal column, the corpora cavernosum, and these are supposed to be caverns that can fill up with blood. This purple-like tissue is the corpus spongiosum that has sponge-like tissue that's meant to cushion the urethra and keep it open. That does not fill up with blood. So some people name the three parts of the male urethra based on what it passes through. From the bladder, we have the prostatic urethra through the prostate, the membranous urethra through the body wall, just short segment there, and then the penile or spongy urethra through the penis there. Okay, and that's the pubic bone here. Back here, rectum. Now, just like in the rectum, we're going to have a couple sphincters. The internal sphincter muscle would be up here right outside the bladder. And that would open when our bladder gets full and give us the urge to urinate. The external urethral sphincter would be about right here. And we would control that when we want to voluntarily urinate. Now, during ejaculation, this internal urethral sphincter will automatically close and stay shut so that we don't get urine mixed in with the sperm. Okay, here's another model. Now here we can see a little better because again, here's the scrotum, sac covering the testes. Remember, that's to keep the sperm a little bit lower than body temperature, because if it's at body temperature, it won't be produced. We need about 4 degrees, 3 to 4 degrees less than body temperature. So there's a scrotum, testes where the sperm is made, epididymis where it's stored. Then we have the spermatic cord here going up into the body. Within that spermatic cord is the vas deferens, which we can't see yet. It's in there, but we can see it start to come out right here. And it's going to, again, go over top of this bladder. It's going to come around, and then the sperm is going to go through the seminal vesicle, add sugar, prostate, add the milky solution. Back here is the rectum. So remember, there is a separation here between the abdominal organs and the bladder. There's like a peritoneum, fluid-filled sac that fits on top of the bladder that actually separates the abdominal organs from the pelvic cavity, the bladder, and reproductive organs. Let's take this off. Here we can see, before I do that, glans, shaft, and part of the root of the penis coming back. Okay, so we'll take that part off, and we'll go ahead and take this part off here. All right. Now, remember that seminal vesicle that was back here, added to sugar? Now we can see, as the vas deferens goes through that, between the seminal vesicle and the urethra, we change the name of this tube to the ejaculatory duct, right there. And now we can see the prostate under the bladder, and we can see the urethra coming through here. So that'd be the prostatic urethra. Membranous urethra going through this body wall we can't really see because we can't take this piece off. And then the penile urethra is going to continue out here. Here we can see the root of the penis, the anchor, shaft, and glans or head. And then the two types of tissue here. Corpus cavernosum on the dorsal, cavern sewing up the blood, and the spongy urethra, corpus spongiosum around the spongy urethra is in the purple. It's more of a spongy-like looking tissue that does not fill up with blood, but cushions and keeps the urethra open. And that is all in the head and up the ventral part of the shaft. Again, rectum back here. Now, I meant to point out, and I still will, the prostate exam, often the doctor will take a gloved, moistened, lubricated finger and stick it up the rectum here and feel to see if that prostate is enlarged. It's the easiest way to see if someone has an enlarged prostate. So usually men over 40, 45, 50 will usually have to have that exam because an enlarged prostate is not uncommon. And they want to make sure it's not enlarged and it's not cancerous. So get ready for your prostate exam as you get older. It goes quickly. And one more. Looks like another male model here. Let's see what we see here. Let's start here again. Scrotum, testes, epididymis. Here we can see the whole vas deferens because they cut the spermatic cord off. Coming here over the bladder. Remember, this little tube here is going to be the ureter coming from the kidney. So we follow the vas deferens. Now we see the seminal vesicle, then the prostate. All right, let's take this off. Now we see the root of the penis here. Shaft and glans. Okay, let's see if this comes off. Okay. Here we can see a little more details on the testes here. And these would be some of the seminiferous tubules here. Right in here. And this would be more of the epididymis, where the sperm is stored, made in the seminiferous tubules, stored in the epididymis. They can't see the vas deferens there. Let's see if it's on this other piece. No. All right, so what else can we see here? Well, bladder, prostate, ejaculatory duct here, prostatic urethra, membranous urethra, spongy or penile urethra, the bulbourethral gland, I don't see, it would be about right here. I think it's on the other section. And then here, this is the corpus cavernosum, and this red is the corpus spongiosum. Again, you can see the root, shaft, glans. This piece that I took off, you can actually see the bulbourethral gland. Looks like it's right there. And you can see part of the seminal vesicle. So as soon as that vas deferens come over the bladder, sugar added by the seminal vesicle, prostate adding the milky solution, bulbourethral gland adding the silky alkaline solution. And together with the sperm, that's what makes up the semen. So that's pretty much it for the male.